Welcome to the topic, drugs for chest pain, myocardial infarction, and stroke. Coronary artery disease. So it is caused by the restriction in the blood flow to the myocardium. We can see a normal artery and we can see the narrowing of artery when there is a lipid deposit of the plaque, which makes the coronary artery disease. The heart actually is the hardest working organ in the body, and the heart muscle or the myocardium, they must receive a continuous supply of the oxygen and nutrients. The heart receives essentially no nutrients from the blood traveling through the heart's chambers, and the heart muscles, they receive its nutrients from the first two arteries branching off the aorta, the right and the left coronary arteries. The first is angina pectoris, which is characterized by the severe chest pain caused by the lack of sufficient oxygen flow to the heart muscle. So in angina, acute chest pain is caused by insufficient oxygen to the myocardium. It is the most common cause, atherosclerosis, and the buildup of the fatty fibrous material called plaque in the walls of the arteries. Reduces the blood supply to the cardiac muscle cells is called as the myocardial ischemia. Here, the plaque and the thrombus formation in the coronary artery is shown beautifully here. We can see the platelets and the fibrin deposit on the plaque and initiate the clot formation. So here it is deposited and they're forming a clot. Now, when there is a clot, so it's a moderate narrowing of the lumen, a little bit. Then it's a thrombus, partially occluding the lumen, and then it's too much of the plaque is there. Then a thrombus is completely occluding the lumen. Then the classic presentation includes for the angina pectoris is it causes the intense pain in the chest. It is often moving to the left side of the neck and the lower jaw and down the left arm, and events associated with the increased myocardial oxygen demand. One types of angina, number one, stable angina. It's predictable in its frequency, intensity, and duration. Then second is unstable angina, which is more frequent or severe, which occurs during the periods of rest. It requires more aggressive medical intervention, and it's sometimes considered a medical emergency because it is associated with an increased risk of MI, that is myocardial infarction. Then we have vasospastic or Prinzmetal's angina. It is caused by the spasms of the coronary arteries. Pain occurs most often during the periods of the rest. So there are some examples of the disorders that may produce the chest pain, like the name of the disease is mitral stenosis, and it is the inability of the mitral valve to fully open. Myocardial infarction, which is cardiac muscle tissue death, which is caused by the clots in the coronary arteries. Hypertension, which is high systemic blood pressure. Coronary artery disease, which is the atherosclerosis of the coronary arteries. And diabetes, lack of insulin or inability to tolerate the carbohydrates. Peptic ulcer disease, erosion of the mucosa of the stomach or the small intestine. Gastric reflux is the backflow of the stomach contents into the esophagus. Then anginal pain, it can often be controlled through the positive lifestyle changes and surgical procedures before we go for the next treatment. So what are these lifestyle changes? We should limit the alcohol consumption to the small amounts. We should eliminate the foods high in the cholesterol or the saturated fat. And we should keep the blood cholesterol and other lipid indicators within the normal ranges. Do not use the tobacco. These little lifestyle changes can help us away from the angina. Other than that, keep our blood pressure within the normal range, exercise regularly and maintain the optimum weight, keep the blood glucose levels within the normal range, and limit the salt sodium intake. Reduces the stress levels as much as possible. I know it's not easy, but we have to reduce it. Then there are some surgical interventions. The coronary arteries are significantly obstructed, then we have to do the surgery. The percutaneous transluminal coronary angioplasty is the technique with the stent insertion into it. And the coronary artery bypass graft can also be done as a surgical procedure for angina. Then pharmacological management of the angina is achieved by reducing the cardiac workload as well. So how do we do that? The goal is to reduce the frequency of the anginal episode. We terminate the acute anginal pain in the progress. And this can be accomplished by, we have to slow the heart rate, dilate the veins so the heart receives the less blood. That is, we have to reduce the preload of the heart. We have to cause the heart to contract with the less force, means we have to reduce the contractility of the heart. And we have to lower the blood pressure, thus offering the heart less resistance when ejecting the blood from the ventricles, reduce the afterload. So in pharmacological treatment, we will be doing three things: reducing the preload, contractility, and the afterload onto the heart, and we can accomplish the goal for making a person angina-free. There are three classes of the drugs that we use. Organic nitrates, which are the drug of choice for terminating acute angina pain. Then we have beta-adrenergic blockers, which are the drugs of choice for preventing angina pain. And calcium channel blockers are used when beta blockers are not well tolerated. So organic nitrates is for terminating and beta blockers is for preventing. So these classes, how they show their mechanism of actions, let's discuss. Number one is the organic nitrates. So we know this is the superior in inferior vena cava where the venous return or the preload occurs. So here, what we will do, the organic nitrates will act on this part. They will dilate the veins. They reduce the amount of the blood returning to the heart. And they dilate the coronary arteries. They bring the blood more to the myocardium. So this is how the organic nitrates are acting onto the inferior vena cava and causing the vasodilation. Then we have beta-adrenergic antagonists. They decrease the heart rate and myocardial contractility. They reduce the cardiac output and the workload. Then is the calcium channel blockers. They're going to act on the arteries and they're going to act on the heart. So they dilate the arterial smooth muscles, they reduce the blood pressure, and they decrease the cardiac workload. Some also decreases the heart rate, reduces the workload on the heart, and dilate the coronary arteries. So this way, they act on to help to treat the angina. Now, first talk about organic nitrates. They relieve the anginal pain by dilating the veins and the coronary arteries that we studied. So there are two types of nitrates. One is the short-acting, like nitroglycerin. They're taken sublingually and they're quickly stop an acute anginal attack in progress. Then another type of the nitrates is the long-acting, for example, isosorbide dinitrate. They are taken orally or delivered through a transdermal patch. They decrease the frequency and severity of the anginal episodes, but they have some side effects also, like orthostatic hypotension, reflex tachycardia, headache, flushing of the skin. Then comes to the beta blockers. So beta blockers are beta-adrenergic blockers. They're sometimes the preferred drugs for the reducing the frequency of angina attacks. They reduce the workload on the heart. They're used for angina prophylaxis, and side effect includes the fatigue, lethargy, and depression. Slowing of heart rate would be contraindicated in patients with bradycardia and heart block. So heart rate should be closely monitored so that if it does not fall below 50 to 60 beats per minute at rest or 100 beats per minute during exercise. We have to be watchful for the heart rate closely. Then we have the calcium channel blockers, which are going to block the calcium channels. They also relieve the anginal pain by reducing the cardiac workload. So they decrease the myocardial oxygen demand. They reduce the myocardial oxygen demand by lowering the blood pressure and slowing the heart rate. And they cause the arteriolar smooth muscles to relax. Other than that, they lower the peripheral resistance, reducing the blood pressure. They dilate the coronary arteries, bringing the more oxygen to the myocardium, and the drug for the choice for a vasospastic angina. Then it comes to the myocardial infarction. It is the early diagnosis and the treatment of the myocardial infarction, which increases the chances of the survival. So in this, we can see the plaque is ruptured erosion with the occlusive thrombus, and the plaque is ruptured erosion with the non-occlusive thrombus. So what are the goals of pharmacological treatment of myocardial infarction? Includes restore the blood supply perfusion to the damaged myocardium as quickly as possible through the use of thrombolytics. They reduce the myocardial oxygen demand with organic nitrates, beta blockers, or CCBs to prevent another myocardial infarction. Then Control or prevent the myocardial infarction associated dysarrhythmias with beta blockers or other antidysarrhythmics. They reduce the post-MI mortality with the aspirin, beta blockers, and ACE inhibitors. Then we manage the severe chest pain and associated anxiety with the analgesics. So any person who got the MI, we have to take care for all these things. Again, the blockage and the perfusion following myocardial infarction, if we see the A part is telling you that the blockage of the left coronary artery causing myocardial ischemia. A patient is experiencing a myocardial infarction, pain is towards the left side and must arrive at the hospital within 20 minutes to 12 hours for thrombolytic therapy to be effective. Then if that has happened, then the large clot lodged in the left coronary artery, tissue distal to the clot becomes inflamed and ischemic, and then thrombolytic therapy is to be initiated in the close proximity to the clots, and then the thrombolytic drug will dissolve the clot and circulation is restored to the myocardium and ischemic begins to resolve. This is how the whole treatment is explained. Then we said just the thrombolytics. So thrombolytics are one which dissolve the clots blocking the coronary arteries. The goals of the thrombolytic therapy would be, we need to dissolve the clots that are obstructing the coronary arteries. We restore the circulation to the myocardium, and the thrombolytics are most effective when administered from 20 minutes to 12 hours after the onset of the myocardial infarction symptoms. Now, the drugs which are used to treat the symptoms and the complications of the acute MI, they include immediate need. They ensure that the heart continues functioning and the permanent damage from the infarction is minimized. Then the drug used are the beta-adrenergic blockers, which reduces the cardiac workload. We have antiplatelets and anticoagulants, in which aspirin dramatically reduces the mortality. Then we have angiotensin-converting enzyme inhibitors, which reduces the mortality following an myocardial infarction. We does the pain management as well, and the patient comfort and reduces the stress with the pain management. Some aggressive treatment of the cerebrovascular accident can increase the survival also. So we use the treatment for stroke. We have two main goals: prevent the strokes through the use of anticoagulants and antihypertensive agents. We restore the blood supply to the affected portion of the brain as quickly as possible. Other than that, thrombolytics are given as soon as the patient arrives at the hospital, and these agents are most effective in administered within 3 hours of the attack. What are the key drugs for all this? The one that we studied: chest pain, myocardial infarction, and the stroke. Antiplatelets, acetyl salicylic acid, and clopidogrel, which is aspirin and Plavix. Beta blockers, acebutolol, atenolol, bisoprolol, metoprolol, nedolol, propranolol, temolol, all ends with the lol. Calcium channel blockers, the common is the amlodipine, Norvasc, and diltiazem, nicardipine, nifedipine, verapamil. Then we have organic nitrates, isosorbide dinitrate, isosorbide mononitrate, and nitroglycerine, which is the first choice of a drug for the angina pain. We use thrombolytics like etaplase and retaplase. So in this topic, we understand the restriction of the cardiac blood flow may lead to the angina pectoris or MI. Angina pectoris caused when the supply does not equal the demand of the heart, and the angina pain initially controlled with the lifestyle changes. Medication focus on reducing the cardiac workload. Medications include organic nitrates, that is nitroglycerine, beta blockers ends with the LOL, and calcium blockers, calcium channel blockers, like with the verapamils and amlodipine. Thrombolytics dissolve the clots in both MI and CVA, but should be administered early. For example, alteplase, retaplase. So all this is the summary for the angina, stroke, and myocardial infarction. Thanks for watching.